the studio. You have a guest. What's going on, my man?
Yeah, again, you know, Thursdays we always like to talk some way or another about something going on in the medical field. So National Drug Take-Back Day is coming up this weekend, a day when law enforcement and health officials are going to collect old or any leftover medications. So today we have Eddie Seijo, who is the director of the New Hanover Regional Medical Center Network Pharmacy there, talking about the safe way to get those drugs out of your home to where they need to be. I wanted to ask you this. I feel like we're seeing this now a lot more than we did maybe 5, even 10 years ago, that this is out there for consumers. Why do you think that is?
Well, sure. We know that obviously we're prescribing medications, and people, we're trying to kind of cut those back with some more opioid guidelines, but people aren't always taking all their medications. We want to make sure they know it's important to get rid of those medications they don't take. So sometimes we prescribe medications they don't always need for the entire course, so make sure they get rid of those medications when they're finished taking them. Do
you feel in any way that the opioid crisis that we are going through right now is kind of driving this, giving it a little bit more importance, that, hey, if these are in your house and you don't need them, you do need to get rid of them and get rid of them in the right way?
Absolutely. So part of our education, our new opioid guidelines, is to get rid of those unwanted or unused medications that, you should take these medications as you need. And when you're done and you don't need them anymore, please get rid of them in a safe and effective manner. And so that's what we really have this take-back event for, to make sure you have an opportunity to safely dispose of those medications.
And safely disposing it doesn't mean toss it in the toilet, hit flush.
Absolutely not. No, we don't want those medications in our waterways. We don't want them ending up in the trash where someone may be able to take them. Other than that, we would like you to take them back to our medication take-back event. We have 9 locations in 4 counties this year, so we're very excited about that. And if you can't make the event this Saturday, then we also have a number of permanent medication drop boxes throughout the area. If you go to NHRMC.org, there's a list of all the locations. You can take those back any day of the week that are permanent throughout the 4 or 5 county area.
Yeah, so again, it is important to stress that while it's being billed as this weekend as the Take Back Day, you can do this throughout the year at different locations. One thing I did want to ask you was not just the importance of this, but you mentioned maybe pills being overprescribed. You know, like, well, doc, I only used 5 of the 30 that I had. Medicine expires. People need to realize that too. So it may be medicine that you forgot you had. You still want to get rid of that because you don't want to take it.
Absolutely. So we have a lot of medication we get a lot of medication from a lot of decades ago that people forget about in their closets, and those expired medications lose their potency, so they're not as effective, and they can also sometimes be harmful. So we want to make sure that people get rid of those medications and use the opportunity like Saturday or our permanent drop boxes to get rid of them.
Is yours one of those no questions asked, we don't care, just bring it in until you can get rid of it?
Absolutely. Yep. So we will have law enforcement there because they have to take them back, but bring whatever you want. Make sure we get rid of it. We just want it out of the streets and make sure we can safely dispose of it.
Yeah, so again, it is billed as National Drug Take-Back Day Saturday. If you can't do it Saturday, you can virtually do it any time of the year. The list is up and running on our website, also on New Hanover Regional Medical Center's website as well.
Pleasure, sir.
Appreciate it.
Thank you so much.
Thank you very much. We're coming back after this.